Hello, I'm Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything education for pain management. Today the topic is, what are the 5 ways that pain clinics beat sciatica? Now, sciatica is when a nerve is being compressed by a disc herniation, okay? It may be something else compressing the nerve root, but that's the most common cause, all right? Now what happens is, pretend this is a disc herniation and this is a nerve root. You're pinching on it and it sparks up inflammation around that nerve root. And that can be very uncomfortable. Sciatica can lead to pain that shoots down the back of your leg, maybe the side of the thigh. It can go down into the foot, and it can cause a burning, searing pain, muscle spasms, pins and needles sensation. It can be very uncomfortable. So when I say beat sciatica, what I mean is avoid surgery for it, okay? And additionally means getting it under pain, get some pain relief. So that is what I mean by beating sciatica. So what are the 5 ways that comprehensive pain clinics do that? Well, first and foremost is medication. When you start having sciatica, it is really uncomfortable. I mean, it can affect your concentration, it can even cause depression, it can make it very tough to drive, walk, play with your kids, all those kinds of things. So medication can consist of Tylenol, anti-inflammatory medication, narcotic medication, and muscle relaxers like Valium or Scalaxin. Well, when you start giving anti-inflammatories, you might want to give a huge dose of anti-inflammatory, and that's called a Medrol dose pack. And that's a big dose of prednisone that tapers off over a few days, and that can give a couple weeks of pain relief and really make the person much more comfortable. So you have the medication management. Next, we're talking about physical therapy. And that involves the stretching and the strengthening exercises along with core stabilization, which can help decrease the pain from sciatica. It may or may not be it might give pain relief right off the bat, but a patient may have so much pain that they may need more medication or injection treatments, such as epidural steroid injections. And those are usually done as a series of injections, maybe 1, maybe 2, oftentimes 3. And that's usually steroid medication to give patients the best chance of pain relief and avoiding surgery. And those can be done every 3 to 6 months if the pain comes back, okay? Another treatment, now we're into number 3, is chiropractic treatment. Chiropractic treatment has been shown to help with sciatica. The spinal manipulations that are done, along with some of the exercises that the chiropractors do for you, can relieve sciatica and be very helpful in the armamentarium of treatment. Number 4 is spinal decompression therapy. Spinal decompression therapy has been shown to be a revolutionary treatment for a lot of problems in the low back. Facet arthritis, degenerative disc disease, sciatica from a disc herniation, failed back surgery, those types of things. But it can really be helpful in the treatment regimen for sciatica. The 5th one we already sort of touched on, and that's injections. Epidural steroid injections for sciatica have been shown to be 75 to 80% effective for relieving pain and allowing people to get back doing the things that they want to do. Whether it's athletics, working, playing with family, socializing, or just doing recreational activities. Those are the types of things that can be gotten back to. Well, what is going on when you're doing these treatments? It's not fixing the sciatica problem, okay? It's not taking that piece of disc that's pushing on a nerve root. It's not taking it away. Surgery can do that. There are some small risks of surgery, so you got to be careful. But what basically is happening is that all these treatments are giving a great band-aid to the situation until this piece of disc is disintegrated by the body. And that happens over 90% of the time. So sciatica treatment that does not involve surgery can prevent the need for surgery well over 90% of the time, okay? So those are the 5 ways that comprehensive pain clinics beat sciatica and avoid surgery. I'm Dr. David Greene with PreferredPainCenter.com. Arizona Pain Specialist does all 5 of these treatments. Call 602-507-6550 today to get started with treatment if you're experiencing sciatica. Surgery is not a necessity. It might be able to be avoided with the treatments that they offer. They have 3 pain clinics around the valley, take most insurances, personal injury, workers' compensation, and self-pay. Once again, I'm Dr. David Greene for PreferPainCenter.com. Your pain stops here.